First of all, thanks for joining us today. This is the third of the webinar series that we are organizing to share the results and findings of the extreme heat research that we have been implementing in 13 countries. So I see that the transcription is going on, but you can turn it off, I guess. I'm going to give you a little bit more information about this program, but first let me start by introducing myself and the researchers that joined us today. My name is Aynur Kadahasanoğlu, and I work at the American Red Cross and the Red Cross Red Crescent Climate Center in a shared position focusing on urban climate resilience. And today we have 4 researchers joining us. We will hear from Niti Mishra from Jamseti Tata School of Disaster Studies, Mumbai, India. We also have Joyce Kimutai, who's the principal meteorologist at the Kenya Meteorological Department, joining us from Kenya. And we have Anjali Joshi from Kathmandu University School of Medical Sciences from Nepal. And we also have Hakimu Sseviiri from Uganda, Makerere University, although I'm not sure, I couldn't see him, but probably he'll join us, I hope, soon. So I'm just going to share quickly my screen to give you a little bit information about this program before handing it over to the researchers, if you can bear with me. So this is not a presentation. I just want to share the website, and I'm going to put it in the chat as well, so you can check it out later. But this research program we announced back in December 2022. It was a small grant program to support local researchers in low and middle income countries. We received quite a very good number of, and quality wise as well, research proposals, and we in the end selected 15 researchers from 13 countries. All the researchers focused on 3 topics mainly: identification of local heat thresholds and triggers, analysis of public perceptions towards heat, and the third topic was identification of strategies to influence policy and action. And today we will hear actually from all of these topics from the researchers. And you can also, in that website, see the researchers, get to know them, and also you can read and download the research reports. You can also find the recordings of these webinars, and I'm going to add this recording as well to that. So with that, I'm going to stop sharing my screen and ask Matt kindly share the presentations, and I'll give floor to Niti once we have the presentation that's coming right now. Niti, floor is yours.
Thank you, Aynur. A very good evening to everyone. It's past 7:30 in India, so good evening to all. We took up this project with students and faculty and members associated with this. We looked at cost-effective solutions, basically modern and traditional solutions, and how effective are they in the current heat wave, especially in the 2022 heat wave that we faced in India and in in many parts of the globe. Next slide, please. Can we move on to the next slide? Yeah. So the purpose of this study was to look at the differential impact of the heat wave, and specifically targeting vulnerable populations like tribal areas, rural and urban area. And we have picked up 3 different locations accordingly. We have looked at what are these cost-effective traditional and modern solutions which are taken up, and if there are any policy initiatives which are providing any relief to the community which is affected by the heat wave. And accordingly, we have certain suggestions and recommendations as part of this research work. Our main questions aimed at looking at which are the indigenous solutions which are viable and cost effective in these locations. and what are the measures adapted by the community to cope with the heat stress that they face on a regular basis. Our research team consisted of a variety of people from TIS. There were students from TIS who were studying in TIS and who had just passed out, and external advisors. We also had grassroots partners who helped us in working on these locations for getting information for data collection, and who are closely connected with the three locations that we mentioned in the study. Next slide, please. So for the study, we chose three highly heat stressed states in India: Rajasthan, Uttar Pradesh, and one urban area in Delhi. And in Rajasthan, we looked at a village which faces low to medium heat stress, but which is dominated, but which is a tribal village. And one of the reasons why we thought it was a low heat stress is because it's an inaccessible part of the village. So for the for the IMD, for meteorological departments to have information about the temperatures in these inaccessible areas is also not possible. So that was one of the reasons why we, even if the reason the our heat map said that this the reason the village is facing low heat stress, but and the adjoining urban areas are showing more heat levels. We went with this village because it's dominated. It has a very high tribal population, and our grassroots partners also helped us in understanding in choosing the villages in the district. In Uttar Pradesh, we looked at the in Gorakhpur district, which was again a high heat stressed region. But in that, the village that we chose was again showed high heat levels with a considerable vulnerable population living over here. And in northeast Delhi, we went with the Simapur locality with the same rationality that the region was facing high heat stress. And apart from that, when we looked at the social vulnerability map indexes using census data, these three locations showed high vulnerability. So these were the three locations which were chosen, and the grassroots partners worked with us to get information on the coping mechanism. These locations also bring out what is the difference between the vulnerability in urban, tribal, and rural areas, and what are their coping strategies that they adapt over a period of time. Next slide, please. So if you see the map, this is the site of study. These are all these region are from North India, which is much closer to the Tropic of Cancer. Therefore, the heat stress, these regions do face a lot of heat stress in the month of April, May, June, and some part of July. So they have had history of heat waves, and they have traditionally also faced a lot of water scarcity and high heat impacts in this region. Next slide, please. So for the research, we used a mixed method approach. We did heat wave mapping. There was evidence gap map analysis, and then based on after looking at what is the available literature from the gap analysis, and looking at to identify the heat map was used to identify the locations of study. We went to the community to look at what is the community perspective on heat wave, what are their coping mechanisms, and to understand their vulnerability and the heat impact and accessibility to healthcare facilities. We use the two models. We use the Tanashi model with the modified sustainable livelihood model, and then the access model. So with a combination of these three models, we try to come up with the findings of the study. Next slide, please. So the heat risk map, the first analysis that we did was the heat risk map, which as I said, identified the three districts: the Sirohi district, the Gorakhpur district, and the Simapur district in northeast Delhi as the high heat stressed region. And in that, we used we looked at social vulnerability data, and we used weightage analysis to choose villages and locations. So that's how we arrived at the villages that we are talking about, and in that we specifically chose the Sivaya village, which was high in indigenous tribal population, the Dasaria village in Gorakhpur, which showed high caste dynamic, and in northeast Delhi, which had a lot of informal labor, and it is an informal settlement. So based on that, we chose these three sites. So we used a mix of the Landsat temperature, land surface temperature data, and the social vulnerability data collected from census data to arrive at our locations and to make the heat risk map. The next slide, please. Yeah, so these are the three the heat risk maps that we made for the three locations. They are not quite visible, but this is for the this is the district that we talked about, Sirohi district, and in here the southwest side we chose the village near the Abu Road tehsil. Similarly, for Gorakhpur district, we have chosen a moderate to high heat stress region, and for Delhi, the region that is being used for the site of the study is informal slum location. Next slide, please. Looking at the after the heat simultaneously with the heat risk map, what we were also doing is looking at the vast literature which is available to understand what are the community coping mechanism at individual level, community level, and at policy level. What is the type of studies which have already been done? So from the period of 2018 to 2022, we looked at we looked at various studies, and we shortlisted some 64 articles, and this was the analysis that we arrived at, where we talked about how geographically and topographical has been the location has been studied. Infrastructure has been one aspect which has been studied quite well, but where we find a lot of gaps is on your legal and policy measures. We find a lot of gaps on looking at what are the nature based solutions of dealing with heat waves, and there are also existing studies on socio-cultural and ecological basis for what has been going on in the region for heat waves. So we looked at global studies, we looked at India specific studies. Again, in India specific, there were very few open access articles available for doing the evidence gap map analysis. So systematically we looked at maps, we looked at the literature, we looked at variables and categories and subcategories to arrive at these variables, and in these we had subcategories of looking at community, individual, and policy, and at state level what are the type of studies which are done. And based on that, we went what gaps we found, we went to the community to ask on what is their perception and how do they understand coping strategies at these three level. Next slide. This is there are
Oh,
there are
sorry.
two more slides. Yeah.
Two more slides.
Yeah.
Maybe can you quickly go, Matt? There must be some. Maybe the other presentation went in between, but you can say stop if you go quickly further.
Okay.
And then
Okay.
we
Yeah.
can say.
I can conclude. I can, because
You have
so
very good recommendations, I guess. Matt, is it possible to just go past the slides?
Yeah. So so as I said, that we were looking at cost effective solutions at community level, individual level, and government level, and we did not
Keep
find
going.
we did not find a lot of studies existing at community and
Here, I think.
government level. And yeah, is it there? No, it's
sorry about that.
no,
maybe
that's
you
okay.
can just say
Yeah,
it
I will just
verbally,
refer
yes.
to my slides, and I will finish it. So yeah, sorry. So yeah, so based on the three methodologies, the recommendations that we came up was that you need more research on cost effective solutions which are targeted at government policies and social welfare scheme integration. When we have a specific we felt the study pointed out that there is a lot of gap. Even if there is health infrastructure available, there's a lot of gap in human resource and trained human resource available to deal with heat stress. Even if there are schemes available for social welfare, they do not address the heat the impact of heat waves. So these sort of lack of preparedness is existing, that needs to be that can be fulfilled through interventions on heat wave. Alternatives of in low and middle income countries specifically, you will get a lot of infrastructure for cities, but you will not find it in the same proportion in rural areas. So that was one of the findings that you could work out. Specifically, you all had asked for what community interventions could be done. So we asked so one of the things that we realized is there are heat action plans which are done at the state level but not at the district or community level. So that could be one measure that could be adapted, making heat action plans, but also having active monitoring of these plans and implementation through using participatory approaches. Legal measures for informal, because a lot of areas that we worked has been dominated by migratory informal settler population, whether in rural or urban areas. We have agricultural workers, and we have people working in informal sector in the urban area. So some legal measures or programs which are specifically guided towards dealing with dealing with this specific population. Uh, that was one of the recommendation. Common spaces which are generally disaster used for disaster preparedness can also be used for primary health treatment of heat wave. And one of the things which clearly came out was because a lot of these areas were rural and tribal in nature, they spoke about water sources for their livestock and animals. So that was one of the making and maintaining these sort of water sources, and creating spaces for people to uh, to access during hot summer days, and how that could be collaborated. So using nature based solution to create such areas. And a homeless population in urban area, which we did not study, which we did not come across a lot in our study, but homeless in urban areas was one population which is largely neglected, and we felt that that is one population that could be the focus of work for further research and further action, program and action for the organization. Uh, yeah, these were the recommendations of this study, and we can if you have questions, I can take it up now or after everyone has presented.
Uh, Thank you so much, and apologies for the missing slides. But your research report is in the link that I put in the chat. So I will invite everyone to actually read the research. Thanks a lot. I think your research, especially really in the comparing rural urban context, and especially talking about social vulnerabilities, has been really, really interesting. And also recommendations for specific context was very, very interesting and really to the point. Thanks a lot. I'm sure there will be questions, but I would like to move to, there's some echo going on, but move to Hakimu, but I'm not sure. Hakimu, can you unmute yourself? We couldn't have a chance to check with you your connection, but if you are there, just please let us know and we can move to your presentation. Oh, he cannot mute. Okay, maybe I'll try to fix that. I don't know why, but can you please log out and come back again? This happens sometimes because I enabled you, but you can try that. And in the meantime, we can just move to the other presentation. I will invite Anjali to present your research, Anjali. And Matt, it is the next presentation. We can just skip some slides. Come to Anjali's presentation, please. Anjali?
Yeah, I know.
Okay, perfect. Okay, your presentation is coming.
Yeah, okay. Hello and good evening, all. I'm Anjali Joshi, Master of Science in Public Health graduate from Kathmandu University School of Medical Sciences, Nepal. And today I'll be presenting on our study entitled Knowledge, Attitude, and Practice and Risk Perception Regarding Heat Wave Among Outdoor Workers in Nepal. And we would like to thank American Red Cross, the Red Crescent Climate Center, Global Health Heat Health Information Network, and Global Disaster Preparedness Center for technically and financially supporting this study. Yeah, next slide, please. And the aim of our study was to explore the knowledge, attitude, practice, and perception of outdoor workers regarding heat wave in heat prone areas of Nepal. And the research team included Dr. Birajman Karmacharya from Kathmandu University School of Medical Sciences, Dr. Lavati Mulsina from Indiana University, USA, Ms. Sabina Marasini from Kathmandu University School of Medical Sciences, and Mr. Sudhim Sharma from Makerere University, Thailand. Next slide, please. It was a mixed method study involving both qualitative and quantitative approach. And in the qualitative part, we conducted 11 focus group discussion among the outdoor workers, and in our quantitative part, we conducted 356 surveys among the outdoor workers, and we conducted these studies in 8 heat-prone districts of Nepal that are situated in the Terai belt of Nepal. And the study population were outdoor workers, including farmer, labor workers, rickshaw drivers, street vendors, business owners, and service providers. Next slide, please. Okay, we assume that the data collection period would go for around 2 months during May and June, which is quite heat extreme period in Nepal. But the data collection period extended to around almost 4 months, and in this period we faced a lot of challenges. Like it was a rainy season here in Nepal, and it was quite challenging for us to travel to the study areas, study sites. And another challenges that we faced was the time availability of our participants. Like we could not get as they were the daily wage worker, and we could not get the specific time for the data collection for this study. Next slide, please. Okay, the quantitative findings were like we asked if the participant have experienced an increased in temperature in these years, to which more than 95% of the participant has experienced an increase in temperature in these years, and more than 86% of the participants have heard about the heat related incidents, and they have also experienced heat related symptoms in the extreme heat days. Either they or their families have experienced the heat related symptoms. And when we asked about if they have got any information from the government or any organization regarding the impact of heat waves, or any information regarding heat waves, to which more than 94% replied no. And we assessed the knowledge of the participants using 6 knowledge related statements. The statement included both positive and negative in statements, to which most of the participants agreed upon the positive statement and disagreed upon the negative statements, which showed a fair knowledge among the study participants. And for the attitude, we administered 6 attitude related statements, to which the participants agreed that heat wave is a serious issue, and personal protective equipment need to be worn during heat-prone days. And they also agreed that their body has been resistant uh, to the heat waves, which showed that they have a negative attitude towards the impact of heat or possible harm. Next slide, please. For the to assist the practice, we administered 13 practice-related statements, to which most of the participants were found to be implementing the protective practical behaviors to protect themselves from the heat waves during summer season, regardless of their knowledge and attitude. And our focus group discussion results were analyzed in four themes, that is knowledge on heat waves, in which the participant perceived an increased temperature and cold climate as a result of climate change. And they also perceive that heat waves can have a detrimental impact on their health and environment. And regarding protective measures, the participants uh, were implementing some of the protective measures to protect themselves from the ill effects of excessive heat. And sometimes the protective behaviors were not a viable option for most of the time. And the major recommendation they suggested were like afforestation, natural resource preservation, and increasing awareness campaign regarding the heat waves and policy revision. Next slide, please. And the major recommendation that we would like to convey from our study is like the government of Nepal should act timely to assess the social vulnerabilities, conduct further research on climate change, and plan for cost-effective intervention, and also co-design some climate-related policies. The civil society organization can assist the government through technocratic and social media approach in increasing the awareness among the people in Nepal, in the community of Nepal. And also they can help in advocating the impact of heat waves in the country. Next slide, please. Okay, this is not included in my slide. That was the last slide. Okay, thank you.
Sorry, I guess this is Niti's slide showing up right now. Sorry about that. Again, apologies. So your presentation finished, Anjali?
Yes.
Okay. Thank you so much for your presentation and for your research too. I think in our experience as Red Crescent, we are also experiencing getting information and feedback that one of the most vulnerable groups are indeed outdoor workers, and they are also usually outside of any social protection measures and not, as you mentioned, not able to uh, take preventive precautions, like maybe, take time off during the hottest time of the day. I think these are the questions and also solutions that we need to really think about together with the governments and employees, maybe. Thank you very much. Again, I'm sure there will be more questions. Did you want to say something about that?
Thank you, Aino,
Okay.
for this opportunity. Yeah, the questions will be welcomed. Thank you.
Sure. Thank you so much. Okay, since we are talking about risk perceptions, I would like to go to Hakimu next. This will be the presentation. Yes, exactly. Thank you so much, Matt. And Hakimu, I hope you will be able to, we can see you and hope we will hear you as well. The floor is yours.
All right. Thank you. Hi, everyone. My name is Hakimu Sseviiri from Makerere University. I'm here to present our research, heat risk perception and communication strategies for low-income communities in Kampala City. First, I would like to appreciate support from the American Red Cross and the Global Disaster Preparedness Center. We supported our team to conduct this research. This research was conducted by a team of 2 senior lecturers and about 5 graduate students, including myself. I coordinated the entire study in Kampala City. Next slide. And now, when we look at climate projections, models indicate that developing countries will face escalating heat risks and are less likely to adapt. When we zero down to our Ugandan context, the hazard is classified as medium based on the modeled heat information by the World Bank through the Facility for Disaster Reduction and Recovery. However, there is still challenges in data gap and variations at local level manifest, though these are not covered. Uganda's temperatures have risen in the past by 0.78 degrees Celsius for the last 7 decades, and it is projected to increase by 2 degrees to 5 degrees in the next 50 to 80 years. And there is more than 25% chance that at least one prolonged heat wave will happen in at least a year. So it's also predicted that heat stress is likely to happen in the next 5 years. Our study sought to explore heat risk perceptions and communication strategies in low-income contexts of Kampala. Next slide. Next slide. Yeah, Kampala is the commercial governance and economic hub for Uganda, and the day population is about 4.5 million, whereas the residential population is about 1.7 million people. However, 60% of Kampala is informal settlements, and 80% of its economy is also informal. This study was conducted in the Chibuye 1 and Waise 3 informal settlements, which are parishes. And these were selected following previous study conducted where we were measuring temperature and humidity in these settlements. And the two settlements emerged as the most hot areas across the entire city. That's why we chose them to conduct this study. We conducted a total of 382 surveys, whereby in Chibuye, we conducted around 290 and 92 in Ewaise, following the available population statistics at parish level. Then we also deployed focus group discussions on women, men, youths, local enterprises, and local leaders, as well as the village health teams in the communities. We also conducted key informant interviews at national, city, and community level. Next slide. Yeah, whereas we planned this research, we encountered a number of challenges which we were able to navigate through. First, there was lack of a universally acceptable definition for heat waves, which presented challenges interpreting the questions to the research participants. Locally here, there are no metrics to determine which period to qualifies to be a heat wave, and whereas information on weather and climate has improved previously, there is no communication targeted to heat waves or extreme hot days in the city. Therefore, we adopted existing narratives of heat wave, which is unusually hot temperatures. So this narrative was used to help respondents and researchers understand the context of the study. Then previous studies have analyzed urban heat using soil temperature determination, in situ temperature and humidity mapping, or measurement and local climate zoning coupled with the geospatial mapping. Therefore, no community engagement had been done, and this study appeared to be alien to the targeted communities. So we provided justification of the study sites as one of the hottest areas across the city, and previously we engaged community leaders to monitor the sensors, temperature and humidity sensors we had installed in our previous study to be able to gain consent from the community and a common understanding to accept the study. Next. Next slide. Yeah, among the findings, we see that over 90% of the respondents were aware of heat waves, and these reportedly experienced them. And among the hottest months across the city were May, June, July, and August, with July peaking the hottest month across the year. Again, when you look at the heat exposure, we see that 49% of the respondents perceived that severe hot days were experienced in the city, and 51% of the respondents perceived that heat waves are most likely going to happen in the coming years, or more hot days are going to happen. For this, the experience of heat waves, unusually hot weather was significant across the study areas, whereas frequency of experiencing hot weather was significant with age, meaning that most of the young people and older people reportedly said that they often experienced hot weather across the city. Then when it comes to the most hot times of the day, this was reportedly afternoon, and this was significant with marital status and main source of income, whereby mainly married people reported to have experienced heat waves during the afternoon hours, and people working in open spaces like the border riders, the market vendors, the street vendors reportedly experienced hotter periods in the afternoon compared to other people. When we come to level of hotness, majority of the respondents reported hot as the level of hotness in the hot periods or episodes, and this was statistically significant with age and monthly income across the entire respondents. Next slide. We also found out the effects of heat risks or heat waves across social groups within Kampala City. And the majority of the respondents indicated that less human mobility was the most prevalent social effect, followed by water scarcity and famine, among others. Then among the economic effects, we see that increased expenditure on cold drinks was reportedly high. Reduced labor productivity was also high. Increased expenditure on health by those who are directly affected by the heat wave was also reported as the main economic effects. With regarding the health effects of drought, the major effect of heat waves, the major effects reported included headache, extreme sweating, extreme thirst, dehydration, tiredness, and dizziness. Finally, when you look at the environmental effects, we see that increased dust on the roads was the main effect reported, followed by air pollution and drying of wells within the settlements that we conducted. Next slide. Yeah, when we try to explore communication around heat waves, and we discover that 61% of the respondents reportedly had already about heat wave. However, these indicated to have
Hakimu, I'm so sorry, but can you please a little bit go faster? We have one more presentation and we would really like to give a chance to audience to ask questions. Maybe a little bit faster.
All right.
Thank you.
All right. Then awareness levels, this was below average, as only 37% indicated to be slightly informed, and about 20% were well informed about heat wave. When it comes to preferred communication strategies, it was revealed that frequent TV and radio programs and adverts need to be emphasized, as well as mass sensitization through community gatherings at local level. Next slide. Next slide. Yeah, then finally on the recommendation, we see that there is urgency to understand heat waves better and how adaptation might be achieved, especially amongst the most vulnerable communities. So there is need to understand and identify who the vulnerable communities are and determine priority actions by CSOs. Then heat risk targeted social protection systems like insurance or social assistance need to be put in place to prove the informal sector, both businesses and residents of the informal settlements. Then fostering interagency and interministerial coordination and cooperation on all climate change hazards need to be emphasized. This aims at creating a common platform to ensure that policies are made and formed, as well as operationalization of priority actions. Then identification of vulnerable groups and creation of heat preparedness plans that target all urban communities need to be considered. Citywide greening of informal settlements should be an action for all actors, since most of these settlements lack the greening and vegetation in their spaces. And finally, initiating local level dialogues on heat waves to foster socially inclusive planning and implementation of heat risk adaptation initiatives. Thank you so much. Over to you, Aya.
Thank you so much, Hakim. I think your findings are also consistent with the other research in the sense that it is really multidimensional. The impacts are not just health, socioeconomic, environment, and the solutions, like you mentioned in the recommendation, has to be also multidimensional. That's really great research. Thank you so much for sharing with us. Now we are going to hear from Joyce, and then we will open it up for questions. And please also put your questions in the chat. I will get back to check the chat. I believe you won't be able to unmute yourself, but please put it in the chat. Joyce, floor is yours.
Thank you so much. I realized that this is the slide is missing my the topic of my research, but that is okay. I am going to just state it. So we looked at research, we looked at identification of local heat thresholds and related health impacts. And we focused on 3 specific case studies. So we looked at 3 cities in Kenya. And my name is Joyce Kimutai. I am from
Joyce, did we lose you?
We
lost you for a second. Maybe you can reintroduce yourself.
Okay. So my name is Joyce Kimutai, and I'm I work with the Kenya Met Department. I'm also affiliated with the Grantham Institute of Climate Change in the UK. And the research here was on identification of local heat thresholds and related health impacts. So we focused on 3 cities in Kenya. We looked at Nairobi, Mombasa, and Kisumu cities in Kenya. So yeah, and I was mentioning that if you listen to Hakimu's presentation, it mentioned a key challenge of having usable definitions of heat waves in Southern African countries. So we don't have usable definitions of heat waves. We don't know what an heat wave means. We don't know when to issue early warning systems. And so the focus of our research was actually to identify local heat thresholds in Kenya and investigate the impacts such thresholds on health in 3 main cities. So basically, we were identifying the heat wave definitions for each city that can be used by the Met and city authorities to issue heat wave warnings. And we had a very research team from Kenya Meteorological Department, also researchers from, so these are researchers who've worked with extremes, and they've particularly looked at extreme heat, and we collaboratively work together to understand, to define these heat thresholds for Kenya. Next slide, please. So we looked at, so I just mentioned that we looked at 3 specific cities in Kenya. We looked at Nairobi, Kisumu, and Mombasa. Nairobi is the capital of Kenya with a population of around 5 million people. Mombasa and Kisumu are the other big cities, but these are the Kenya's main economic hubs. And these cities have living in informal sectors, they're vulnerable populations. So it was good to understand, and also the weather and the climate is very diverse as well. So it was good to understand how we can, how is heat impacting the people, and how we can define thresholds that can be used to issue early warnings in these cities. And so we looked at hospital data and the climate data. So we looked at climate data from weather stations, looked at daily maximum temperature and minimum temperatures, and we tried to analyze or understand the hospital data from the nearest hospitals to the weather stations that we were looking at. Next slide, please. So how did our research go? So we were focusing on looking at the sort of the, we identify like the discrete thresholds using maximum and minimum temperatures that were exceeded between 1 to 10 days. And so we got the data from the Climate Ministry of Health repository. We had a challenge obtaining daily records of data, especially from public hospitals. It's quite important for us to focus on public hospitals because we found that it had the data that was representative of the vulnerable. And we ended up using monthly data from monthly hospital data, which was quite good as well. And then we got an ethics clearance to do that. And so just to mention that we analyzed at least 10 heatwave events between 2010 and 2020 based on max and minimum temperatures. And for hospital data, we focused on heat-related cases. And these were cases of doctors who were actually giving us the data. And if you look at my research team, we have one of the doctor, he works with the Ministry of Health, who was working with us, advising us, working with us to see if these definitions made any sense, actually classifying the data as well to really make meaningful deductions or conclusions from this work. And for admissions and deaths, we used all cases. We considered all cases because we know that its exposure is actually known to have sort of a complex set of physiological effects on multiple organs. So we thought looking at admissions, all cases of admissions and deaths of the doctors as well. Next slide, please. And so looking at the findings, I wasn't able to put all the plots here because there were a number of plots we're looking at. 2 weather stations in each city and 2 hospitals in each city. So that would be like 6. So there were multiple sort of analysis that. But right. And from the analysis, we focused on, so when we identified these heatwave events, we found that there was a most extreme and outstanding event that occurred in March of 2016. And it was, we found it very important for us to focus on that because it was a common event across all the 3 cities, and we thought it was an interesting case study for us to look at. And that event lasted for at least 7 days in each city, and so then we decided to focus our analysis on that. And so what we did is we tried to look at the temperature for March, so the temperature conditions for March from 2010 to 2020. So when we first from at least 40 years, 38 years, 40 years. But then we decided to focus on the most recent heatwave events. So we looked at 2010 to 2020. And so then we looked at March, all the March months from 2010 to 2020. And we tried to see the correlations, or how were the the hospital data. So we were trying to understand if there were any spikes in that March, April, May, in that March season of 2016, in terms of the hospital cases. So in terms of the visits, admissions, or the deaths. And so what we found out, so we have a number of, we did a number of analyses and a number of correlations. And what we found is that there was a significant correlation between maximum temperatures, admissions, and deaths in Mombasa, in stations and hospitals in Mombasa. In Nairobi and Kisumu, we also found a significant correlation between minimum temperatures and deaths. And in Kisumu, we found a significant correlation between minimum temperatures and admissions. So we could see that across the 3 cities, there was really, for sure, a significant correlation between temperature and admissions. And what we also found out from our analysis is that there was a possible delayed effect fatalities. And we say this because for the analysis that we looked at, we could find that there was a spike in mortalities in the month of April, especially the first few days of April. And this heatwave event that was identified in March 2016 was in the 20s of the month, so in the late March. And we could see sort of a consistent pattern of elevated cases of mortalities in the 3 cities. So we could, it was not a concrete finding because we didn't interrogate it further, but we somehow could see that there might be a possible correlation, sort of a delayed effect of its health impact on mortality. So it's like that effect manifests itself slightly later. Next slide, please. And so, yeah, and I will just go quickly to the recommendations. So what we concluded from our study is we were able to identify heatwave definitions for issuing heat of alert warnings, and for sure, the implementation of early warning systems require location-specific definitions, really. That takes into account sort of vulnerability and of the population, and even the sort of the adaptability. And so for this, for the 3 cities in Kenya, Nairobi, we say that at least authorities or Met offices must at least issue a warning when we record at least a maximum of 32 degrees for 3 consecutive days, 3 or more consecutive days. And for Kisumu is 37 degrees, at least for 3 or more consecutive days. And for Mombasa is 36 degrees for the same period of time. And we recommend that we could use these as trigger protocols, and these can be used for deployment of health action, for emergency response plans, and also for just any normal early warning information. And what we also draw particular attention to hospital managers and medical practitioners was to pay attention to patients especially when these warnings are given, or when these temperatures are forecasted in these 3 cities. Thank you very much.
Thank you so much, Joyce. This is one of the 3 studies, researchers that focused on health impacts and the triggers and local thresholds and triggers, and it was really interesting. So there's a lot of questions in the chat, so I'm going to start with that. I think this is for you, Joyce. Did you check beforehand what the hospital staff that entered the data understood the term heat wave? Joyce, this is for you.
Thank you so much. That's a very that's a very interesting question. Yes. And I remember, I remember the first time when we approached the hospital staff, and we were saying that we would like you to be part of our study. We're trying to do this study, and it would really be important to our view in the study. And we started by asking that we'll be looking at heat waves, and of course they were like, oh, we've been waiting for such a study, because they were not sure of what so like basically in Kenya that we know the months that are a bit hot. So March, so January, February, March would be like climatologically hot months, and they say this is the time that we sometimes experience a lot of spike in cases of admissions and hospitalizations. But they were saying that they're not quite sure if it's related to other things. And we were saying, and that is the reason we want you to be part of this conversation, and we want us to see if so by us. So yeah, I remember we asked that question. They were not aware, but they were excited to be part of this.
Yes, thanks. There are more questions for you, but I want to go to another question from Effie, one of our researchers. This is for you, Anjali. There's a long note. Probably you can read it. I don't need to read it. But the question is, can you mention the daily temperature data, the minimum, maximum temperatures, and how the temperature changes in your research area? Anjali.
Yeah. Hi, Effie. Okay, I will try this one. Actually, this was a very, very preliminary study in Nepal. Not much research have been done in the area of climate change